morning, Average Medical Practice. Vicky speaking.
The first time she went to the hospital, they said she only had 2 years to live.
A month ago?
Yeah.
Suppose it's like trimming a ham.
I don't want that on my Sunday roast.
A bit like alien, isn't it?
God, it was massive.
Oh dear, that's quite itchy. It's itchy, quite mad, isn't it?
Honestly, it's all over her body. It's everywhere.
How long have they been married for? Because they were so close, weren't they?
Oh, 40 years. Oh. And I wasn't going to cry.
Oh, it's okay to cry.
They like contraction pains I'm getting.
How many weeks are you now?
I'm 17 weeks and 6 days.
Morning, Emily.
Morning.
How are you?
Not very good at the moment.
You look very nice.
Oh, thank you. Try my very best.
Of course you do.
Thank you. You look younger every time I see you. You're going backward, not going forward.
Oh, thank you.
Come in.
Hello.
Hi, hello, Adam. Come on in. Oh, that looks painful. All right. Just remind me when you trapped your finger in a fairground ride.
It's been a week.
And you went to hospital? What did they do in hospital?
Went to the nurse, bandaged it up, so it should be okay. You don't need any stitches.
How are you feeling about it?
I'm worried.
Does it hurt now?
No.
Does it keep you awake at night, you know, when you're sleeping? Yeah. Just put your hand in my hand there. I promise I won't hurt you, I promise. I'm just going to have a look. If you just turn it around. What is that? That's really sore. What about on this side? Yeah, OK. So I think there's a couple of things going on here. The nail is blue and sore because it's bled underneath the nail, and that's putting lots of pressure on there, which is what's causing a lot of the pain. With all the swelling that's going on, I just wonder whether he's broken the tip of that finger as well.
Oh, right,
OK.
Right.
Right. Am I making you feel more nervous? Yeah, I'm sorry. Right. What's hurting you is the blood underneath that nail, OK? And the minute I put a tiny little hole in that and that blood comes out, it'll be a bit like all the pressure's gone and some of that pain will come off, OK? Right, so how are you feeling about me just using a little hot needle to put on there? You won't feel the heat, you'll just feel a bit of pressure. OK. All right, good lad, good lad.
Is it Kevin?
It is, love, yeah.
Just through here.
No problem, thank you. Cheers, love.
There we go. Come and have a seat. Right then. How can I help?
It's my leg, love.
Oh, yeah, look at that.
Yeah.
How long's it been like that for?
This has just happened 2 days, love.
OK, it's quite red and angry, isn't it?
I was thinking about going to hospital last night.
Right, can you take your socks and shoes off for me? You've not got any ulcers or blisters or
No, love,
breaks
no.
in the skin?
No, as far as I know, love, no.
And has this ever happened before?
No, love.
Just a
No.
one-off, yeah? It looks really quite swollen. Does it feel tight?
Right at this moment, love, no. It seems it was yesterday, and I mean really tight. I felt like my leg was broke.
Right, let's have a look. I just worry whether that's infected. You've got quite a clear red line.
I mean, really,
around
I
that,
wouldn't have even
haven't
let you touched it before because, honest to
Yeah.
God, it was that painful. I felt like crying.
Yeah, I just wonder if you've got a bit of cellulitis, a bit of infection in that
I
foot.
don't-
So I think what we need to do is give you some antibiotics. Whenever you're sitting, get them feet raised up.
Yes, love.
Right, let's check your temperature.
Yeah, no problem, love.
OK, that's good. Now, are you allergic to anything?
No, love.
No.
No.
So I'll give you an antibiotic that we know is good for the skin.
OK, love.
I've given you a week's worth.
OK, love.
The other thing I want you to watch is this redness here. You can see almost a line here,
Yeah,
can't
yeah.
you, around it? Keep an eye on that. If
Yeah.
that redness extends and gets more rather than improves with this,
Okay.
we need to see you again. So keep them legs raised up,
I will do, love. I will do.
All right, then.
Okay, then.
So Take care.
Thank you very much for that, love.
Bye-bye.
Bye-bye.
Bye-bye, love.
Bye-bye.
Bye-bye.
Bye-bye, love. Bye-bye.
Right, just pop your hand down there for me. Okay. Right. Why don't you look the other way while I do this? It's best not to look.
Me, not the door.
Okay, now it's really important that you keep as still as you can. Okay, Adam. Here we go.
It's hurting.
Okay, just bear with me a second.
It's hurting a bit.
I know, darling. Here we go. Are you okay?
I'm good.
You just need to do it a little bit more, then we're there, okay? It's going to hurt a little bit now. Here we go.
Oh, done. You're doing good.
That's it. Okay, so some of that pressure should come off now. Are you okay?
Yeah.
Not too bad? Yeah, you've done really well. So I'm going to book you back in to see me after you've had the x-ray done. Keep that on nice and loose, okay? Do you still like fairground rides? No. Did you go on the waltzers? They've got waltzers.
Yeah, that's the one he got injured on.
Oh, is it? Oh, we won't talk about the waltzers.
How's your son? It's not good. His knee's out here, and it's all fine. He's had a bit of bone lump removed from his leg, but he can't walk. I'm having to do Luke's paper round.
Oh, he's got a paper round.
Yeah, it's embarrassing. Doing a paper round at my age. Right.
Oh, my God.
Come through.
Hey, okay.
Hello there, you're all right. I've got a couple of medical students with me. Is that all right?
Yeah, it's
Sit
fine.
there.
Yeah,
All
it's
right.
fine.
Come through, sir. Take a seat.
Right. So,
Dear, you're seeming a lot of pain.
yeah.
What's going on?
So 20 years ago, I got run over. I broke my leg in 3 places.
Oh dear.
And when my femur grew back, it grew back shorter. So I limped and my hip bone kind of wore away. So they had to screw it.
I see.
But this last month, I've been getting it really bad in both hips. Sunday morning, I woke up with just really bad pain in my hip, and just my right hip. I can't put weight on it. I'm just getting constant pain all the time.
And you don't remember falling or injuring it in any way?
No.
Right, okay. And how are you in yourself? Any fevers?
Yesterday, I felt like we were going to pass out.
Right. Is it because of pain?
Yeah.
Do you mind if I have a look at it?
Yeah, it's fine.
Yeah, okay. If you just get on.
I can't lift it.
You can't lift it, right? Let's give me a hand.
Oh!
It's all right. Right, so look, if you just relax your leg. Okay, I'll try to be as gentle as I can. Okay. So that's the best you can tolerate.
Yeah, that's how, yeah.
Okay. Sorry, I'm just going to try and move the other way. You're not able to do that, are you?
Yeah, it hurts.
Right. This is clearly a bad one.
Blimey, give me a shot, fine.
Press that green button there.
That's it.
No, not that one.
No.
That's emergency alarm.
Just looking, I think I spilled some coffee down my top. Oh, my God. Oh, my God, I'm locked out.
Hello there. Hi. I think you've come through the wrong door. You see this no room 6? No, that's next door. Oh.
John Williams, please.
That's me.
John Williams?
Yeah.
All right. Excellent.
I was already out the door ready.
Excellent.
Do you have any thoughts? Have I given you any clues by what I've been looking at?
Dear me.
Just relax. Right. That seems to have a more range of movement than this one. This is clearly a bad one.
Yeah.
That's okay, sir, if you just... So you did have a surgery onto this hip joint?
Yeah.
And how old were you then?
From what I can remember, I think I'm about 14.
14?
14, 15.
Did they tell you what the diagnosis was?
Arthritis, I think it was. But they did say it might not last that long, and if it does, it'll be a hip replacement. They said that when I was a kid.
Yeah.
But I've kind of just... I've been fine. I play football, I go running.
Yeah.
I'm kind of fit and healthy.
Yeah.
But then every now and then, I get quite a bit of jip.
Okay, I can give you some painkillers now. And the other option is I can have a word with the hospital doctor. Yeah. Okay, and they can assess you there. Yeah. Okay. I'm just going to give him a ring. My name is Dr. Saeed. I'm calling from Ridge Medical Centre. I've got a patient, so he's 29 and he's had previous surgery to his right hip. Now today he presented with a 4-week history with gradually worsening hip pain. I was hoping that if you could assess him, please. All right. Thank you very much. Thank you. He's just going to have a chat with his senior colleague and then they'll ring you straight. Okay, so they've got your details now and hopefully they'll ask you to go straight on the ward and then they'll assess you there. Right. Is that all right?
That's fine, yeah, great.
Okay. You gonna be all right?
Yeah.
Good morning. Hiya, new baby. Yes. Congratulations. Daddy as well.
Hello.
Hello, love. In you come. Take a seat.
Thank you.
Oh, another one.
Yeah. All together 5.
Full family. Yeah, so this is baby Syed.
Yeah,
7
baby Syed.
weeks old.
Yeah.
And then, so you went to out of hours yesterday.
Last time to till this time, he's never sleep. He's just crying like this, still
So
crying.
ever since he was seen in hospital, he's cried.
Cried, yeah.
Is it a cough or is it...
No, nothing, no cough, nothing. I think his tummy problem, something like that.
Right. Is he breastfeeding or
Yeah,
not?
breastfeeding, yeah.
Is he taking plenty?
Yeah.
Yeah, he's taking plenty. No fever?
No.
Right, take his clothes off and we'll have a look at him. Any vomiting? Yeah. Big vomit or little vomit?
Big.
So if Mummy's feeding him there, would it come to here or would it come to there or would it come to there? Just down here.
Chup. Bas.
She says, no diarrhea?
No.
Normal poo? Has he had wet nappies, dirty nappies?
No.
Not as many wet nappies? I'll just have to ask the hospital to look at him again because I can't find any reason. But sometimes babies get a condition where they do this big vomiting and it's a common problem. And if the vomiting flies out, and we need them to check him because now and again they have a condition where they might need a little operation. It comes on about this age. If he's vomiting after most feeds and not having the wet nappies, it could be that. So now then, I can either ring the hospital now or you can take him home, feed him, and I will see him again this afternoon and then I'll ring the hospital then if he's no better. Okay. So you're very experienced parents, aren't you? That's why it's worrying because you know how to look. Yeah. Shall we just try him with a little bit of Gaviscon? You can mix it with some water and see if that helps him, and if not, we'll think again. Okay, see ya.
See ya.
Where'd you get one of them from?
That's cute.
Can I have one?
You can have one. My husband bought me this. Watch this. This is best bit. Go sleep.
I love it.
Remind me what your little boy's called. Connor. Did I tell you that my Shay was meant to be a Connor?
Oh, really?
Yeah. And my come and have a seat. And my cousin just had a baby just before him.
Right.
About a month beforehand. And got in and called him Connor.
Oh, no, best name.
Right, my love. The last time I saw you, you were struggling with these jerks.
That's right, yeah.
Because you've always said that it's the epilim that's been the best one for you, yeah?
It is, yeah.
So, last time I saw you, we were pushing it up a bit?
Yeah.
How are we doing?
Still not great.
And the jerks are still the same as before?
They are.
Claire, we don't know why this happens. We don't know why this happens. Sometimes it does.
But it's not just the jerks, it's so difficult to explain. But like I'd gone shopping and it's a feeling of like I'm almost not there. Like I want to pass out and everything's going on around me.
How often's that been happening?
Every other day. Yeah.
Is that new?
It used to happen before.
Did it? When you were, can you remember it happening when you were younger?
Yeah, because I used to have, and touch wood, they stopped, but the drop seizures. So I would walk and be on the floor but not being able to
and
feel
how old
myself.
were you whenever you had those?
About 18.
About 18, right? You used to have drop attacks, okay.
Yeah.
So do you think you've been free of those since you were about 18? Or
Yeah, probably since the epilim.
How do you feel about increasing your epilim further?
If that's a possibility.
Yeah. You know, we can go way up in your epilim.
Yeah.
It's just always the side effects we worry about, but
yeah.
the main ones that people complain of are weight gain and tiredness.
Weight gain, like see, that's an interesting one.
Do you think
I do feel like I have put a bit of weight on.
I mean, I'll be honest with you. I think you look great. But actually, the last time I saw you, I thought you looked thin.
Oh, really?
Yeah.
Okay.
And where maybe if you have put on weight, it's going in the right places. But just keep an eye. And you know, if weight gain bothers you and is something we need to talk about, we'll talk about it.
Because it just tends to sit round here. That's obviously having children, yeah, that's and cesareans, that's going to be a given anyway.
Tell me about it. Yeah, I know. And if you can tell me how to get rid of it, then I'll give you £1 million. I'll find it and give it to you. Radio. So we are going to go to 900 and 900.
Okay.
Yeah. Is that?
Yeah. Just anything, just to train. Yeah.
Right, my love. You take care.
Yep.
Good to see you.
Yeah,
Good to see you looking well. And thank you for coming. You can come back because you've just been super duper, haven't you? Yeah.
Right. My name's Dr. Said. What can I do for you?
She was in yesterday and they've referred her for a patch test doing. I think it's hives what she's got. It's like they're not, I don't know what they're diagnosing her with. I'm just going, they're giving her something and then coming back.
Right.
So I don't actually know if it is hives what she's got.
Oh dear, that's quite itchy. She's itching quite madly there.
This is itching that bad. She's crying to me. She's wanting to put cream on her own.
Right.
It's all over her body.
Yeah, I've been going through the notes. Apparently, she has been referred to dermatology, but it's really important that, you know, you keep her away from the sun and keep her kind of covered and use the sunscreen until we get to the bottom of it. Right, I can see that she's quite itchy.
This is all, honestly.
Let's have a look.
It's bad. Nyla, can I have the phone a minute while Doctor looks at you?
Oh, that's where the noise is coming from. It's coming from.
Right,
so where did you see most of the rashes on the face?
Her face swells up, her eyes swell up the most.
Right.
And the backs of her legs have started today. And then it was under her leg. She just keeps scratching upon scratching, so it swells and then it goes down.
Yeah. Let me see. Have you noticed any rash in her scalp?
You know, like when you get goosebumps, and it'll be, honestly, it's everywhere in a minute, Keela. You can see how it leaves the skin marked.
Yeah. So she's had some cetirizine yesterday. Is that helping?
Obviously not, no.
And what have you been using in the past?
Oilatum. They're just giving me a Vena, Oilatum.
Yeah. I think because she's quite itchy, I'd suggest her using the calamine lotion again.
Would you?
Yeah, because it really helps with the itch. Now, carry on with the cetirizine.
Yeah.
And...
Don't itch it, darling.
I'll give you a cream.
Right.
Okay. Now, apply very thinly on the face, like literally with just the tip of your finger.
Yeah.
And make sure that nothing gets into her eye.
Right.
Okay. And we'll see how she responds to that.
Yeah,
okay?
that's great.
I would expect things to settle in the next few days. If the rash gets worse or she's not liking the cream or symptoms get worse, then come back.
Come here, no. Do you want Mummy's phone back?
Can you say my name?
Let's go.
What is it?
Let's go.
Oh, it's a skeleton. Skeleton.
Oh, a skeleton.
Yeah, it's a curtain.
Right, see you
Thank
all.
you so much.
All right.
Say thank you, Nige.
Bye.
Say bye. Bye.
Bye.
See you later.
Take care.
Oh, go on then.
The remote name could not be resolved. Bloody hell. Gas! Gas!
Oh, don't ask me to do it again. Don't ask me to do it again.
But look, what's it doing? What? Oh my God, how many's open now? Jesus.
What?
What are you doing?
I can't even spell my own name.
Oh, bloody hell.
Hiya, Vanda.
Hi.
How's it going, diabetes-wise?
Fine, really, just as it has been.
Yeah?
Although I did have a really bad hypo where I felt I was going to pass out, and that is the first time ever.
Said it was the worst one you've ever
Yeah,
had.
I've ever had. But I've only had that once.
Tell me about if you've had any other funny shaky do's.
Yeah,
you do have them, don't
I
you?
do have them, but not very often.
But have we got a new thing with this liver condition? You've got this little bit of fibrosis in the liver, haven't you?
Well, is it a little bit? Because, you see, I don't know where I stand with this.
She's really confused because the first time she went to the hospital,
Yeah.
the liver guy said pretty much she only had 2 years to live.
Right. It's a bit of a shock.
Yeah, and we couldn't...
When was that? I hope it's more than 2 years ago.
A month.
And we couldn't understand
A month ago?
Yeah, because she was having liver function tests.
Yeah.
And nothing's ever been flagged up.
Yeah.
And so it was a massive shock, wasn't it?
Yeah.
Three letters ending in Y. Very good.
Hello, come and have a seat. I'm Linda Eves. Brought a little helper with you today. That's my little daughter.
What's your name, darling?
Khadija.
And what does your mum do for you to help?
She pushed him over and says help you up.
Sorry, can I ask the embarrassing question? You're not using contraception at the moment because you don't need it, is that right? Yeah?
I like purple and pink.
Because they're your favourite colours, aren't they?
Okay, what I need to do, I need to have a look inside your mouth. All right.
She has cleaned her teeth this morning, though. It's just, it's bad.
You see, I didn't realise that all these different things stem from diabetes because it never affected me.
Vanda suffers from type 2 diabetes and also has a condition called non-alcohol-related steatohepatitis. This is a condition where fat deposits within the liver cause inflammation. Unfortunately, Vanda has been unlucky in that her fatty liver has progressed to inflammation and scarring or fibrosis.
You know, I still find it so hard to believe that it's still not showing up.
It's well recognised that the tests we can do often don't pick it up. Well, if you think about your liver, you can lose a kidney quite easily, can't you?
Yeah.
And still be fine because you've got enough reserve. With your liver, you can lose a lot of your liver.
He said I've got plenty of meat inside.
Meat inside? What did he mean?
Like fresh meat, if you like. You know, top and bottom were knackered, but middle bit were
Right, so plenty of liver meats, he means, doesn't he?
Yeah.
It's a bit of a bitter pill to swallow because you've never been a drinker. You've got...
No.
Yeah, it's the diabetes. I'm not as negative about the outcome.
Early signs of liver fibrosis are reversible with lifestyle and improved diabetes control. However, as fibrosis progresses, there's more chance of it progressing then onto liver cirrhosis.
Is this likely to progress faster, liver, or is there anything she can do to help herself?
Yeah, what we want to do is keep everything nice and stable. But it looks as though there might be enough liver functioning well enough to keep you going. So I'd be optimistic about that.
All right, that's good.
You're on 2 medications, aren't you?
Yeah.
You're on your insulin and you're on your metformin. What I think we should do is cut your insulin down by at least half. The metformin, I'll just wait at the moment. I'll look at your kidney function as well.
OK.
So, does all that make sense?
Yeah.
Right.
Yeah.
See you in 4 months.
Right, OK.
Right, cheers. See you later. Cheers. Thank you. Bye.
Shall I leave him a message to say, please contact the surgery?
Yeah, please. Hi, it's Dr. Tatham.
That was my impression. Rubbish, wasn't it?
My kitten's taking the mick out of me in my East Yorkshire accent. No. No.
I like that.
Hi, I'm Dr. Khan. Nice to see you. Nice to see you. Hiya, you're right. Who have we got here?
It's my daughter, Caprice.
Oh, hiya, Caprice. That's a nice name.
Thank you.
Right, I understand you've got a lipoma. Yeah. And what do you understand about the term lipoma?
Nothing really. It's just like a fat growth.
Yeah, it's just a lump of fat. Sometimes the body just kind of deposits it in this kind of circular growth.
Like the past 2 years, you've just noticed it and it just seemed to get bigger all of a sudden.
Maybe I've had more holidays and noticed it more.
Shark fin when he's swimming in water.
Is that why it's just come above the waterline?
The Meg.
Yeah. Should we have a look at it?
Yeah, of course you can, yeah.
Oh, it is a big one, isn't it?
Yeah.
OK. Right, yeah, we'll take that off for you today.
That,
yeah.
I've seen one bigger than that before. Right, good.
No, it's my first one. It was bigger than I was expecting because in the letter she's referred to it as a 1.5 centimetre lipoma. So I was just surprised. All right, so we'll get it all out. We just need your top clothing off.
OK.
So if you just lie on your front.
On my front.
Yeah, that's it. Right, so I'm just going to give you your first injection now. So here we go, it's just a sharp scratch. Can you feel that?
Yeah, but it's not sharp pain.
I'm going to start, and then if it gets painful, let me know, because I think what you're feeling is more pressure. But we'll have a look and see what you think. What does that feel like?
I felt like a scratch.
Is that yeah? Let's try a bit more.
You don't want to part with it, really, do you? Have you got quite attached to it after 20 years?
Right. If it wasn't big before, it is now because it's full of fluid.
Get to play football with that when it comes out.
Right. Let's see what we're dealing with now. Is that okay?
Yeah.
Yep.
Come through.
Hiya.
Hello there. Hey, come and take a seat. Right, what can I do for you today?
I think you received a letter from the hospital. I just come to discuss that, really.
Right, what was it about?
Well, I went in for my thumb. They said I fractured it, and then on X-rays they showed it as arthritis.
Right, so is it only one joint, or?
I know it's well, this problem's been about 3 years now.
Mm-hmm.
It started off with my elbow, my
Right.
wrist, my thumb, and then my other joints, my fingers as well.
So does it come and go?
Yeah, it comes and goes. It stays for about 3-4 days.
Right.
Then I won't be able to move the joint as well.
Okay.
And it swells up as well, like my thumb on the side of here, on both sides, it quite swelled up.
Right. Have you noticed any other symptoms at all, like red eyes or any ulcers in your mouth?
No.
Any rashes anywhere?
No.
Okay, any changes to your nails?
No.
No. Do you mind if we just have a look?
Yeah.
Right, so let me just have a feel of your wrist. Just have a feel. How does that feel when I put
That's
pressure
fine.
on that? Let me feel the other one.
Yes.
Okay. And that's okay?
Yeah, that's fine.
Are you normally stiff in the morning?
At times, yeah, it's mainly my fingers and stuff that I feel quite
Right.
stiff.
And how long does that last for?
Not long, probably about 20 minutes or so.
Right, okay. Now, what the hospital was suggesting that they think this could be arthritis.
Yeah.
Now, arthritis could be of different types.
Types, yeah.
One is inflammatory arthritis,
Right, yeah.
where your body's own immune system attacks your joints.
Right.
Okay, and the first thing that we do some blood tests. If they come back positive, then what I will do the next step will be a referral to rheumatology.
Right.
Okay, so I'll do those set of bloods. Hopefully we should get results in a few days.
Right.
Okay, and then I'll talk to you once we have those results back.
That's fine.
Okay. Is there anything else you want to ask me?
No, that's all for now.
Is that all right?
Yeah.
Okay.
All right then, thank you.
Take
See
care.
ya.
So Ellie, you can see that it's kind of a pinky colour at the moment, which is a cutaneous tissue, but just lurking underneath that you can see spots of yellow, and that's the lipoma.
How are you doing?
Yeah, I'm doing good. Yeah, I'm quite relaxed now, yeah.
How are we doing?
It looks gross.
It's impressive, isn't it? Yeah.
I suppose it's like trimming a ham.
I don't want that with my Sunday roast.
Like alien, isn't it?
God, it looks like an organ. Massive.
A church organ.
Are you okay?
Yeah.
Yeah.
I'm good, thanks.
We're nearly there now. It's coming
Good.
out. Okay, we're going to need a big pot for this one.
I think we've only got one size. Yeah, it's nearly there.
Good.
Nearly there. I don't think you're going to get all that in pot that we've got.
It looks a bit like a chicken breast.
It does a bit,
Before
doesn't it?
it's cooked.
Yeah.
So how many stitches will this take?
Probably 5 or 6.
Do you have to do needle crafting for this as well?
Yeah, crochet, knitting. You know what? I can't.
Oh.
If you can do that, you could definitely do buttons.
I don't know. I've never tried. Right, I'm just going to give it a cleaning. We'll put a dressing over it.
Okay, fine.
It looks good, Dad.
Good.
Oh, thanks, Caprice. Does that feel better?
Brilliant.
I've lost my tongue piercing, Veronica, and I'm not right happy.
Oh, that just really...
What? What?
I just can't imagine. Why would anybody want to stick a thing in the tongue?
Because it's satisfying.
Is it?
I'm coming home. I need to pick up my maternity notes. She's coming with me. She's coming with me to the hospital to Leeds, she said.
Salam Rafiq.
Okay, I'll speak to you later.
Salam
then, babe.
Rafiq.
Okay, I've got called in. Okay, bye, babe. Bye.
Hi, my name is Dr. Hutt. I'm seeing you instead of Dr. Yunus. Is that okay?
I've got a scan as well.
Have you got a scan today? What time?
It's at 1:30.
Okay. I'm sorry about the wait. Please have a
it's okay.
seat.
No, it's okay.
So, what's the problem?
I've got, they're like contraction pains I'm getting.
Okay.
It's just like lower down.
Lower down.
I'm getting shooting pains in my vagina. And yesterday there was, do you know, in my back passage, there was severe pain there. Do you know, like now when I'm sitting down, I've got on and off coming pains.
Okay. How many weeks are you now?
I'm 17 weeks and 6 days. But I went into early labour with Malika originally.
How early did you go in?
I went in 18 weeks and then she had a heart problem. And then I went on to like steroid drip. So I went in quite a few times.
Okay.
Yeah.
Okay. So you're worried about that?
Yeah.
Okay. And which number pregnancy is this? Yours?
It's 5th.
Okay.
It's
Are you
just
weeing okay? No burning, stinging,
okay.
or no blood or anything
No,
that you've
nothing like
noticed?
that, no.
Anything? Okay. And this pain, when did it start?
It's been, I had a car accident, and at that point they did start, and then they've settled. And then since yesterday, they're just getting worse again. It's like in my back passage, I've not had it. But then since
Does it
yesterday...
feel as if, like, you know, there's a pressure?
It's a pressure, that's what it is, and even now, it's not easy enough.
Favourite animal?
Ooh. I've got loads. I love animals.
And one slightly weird question. You don't keep birds as pets?
No.
Not a pigeon fancy or anything like that? Okay.
So he's currently on holiday and he's been scratched by a cat. He wants to know if he's been covered for rabies.
Do us a favour. Open that for us, please. Got a spider in there. Melody, she don't like spiders.
What kind of dogs do you have?
A Staff and a Shih Tzu.
Nice
them shih tzus out.
Oh.
Is it a hot water bottle? I thought you were carrying a rabbit. I was like...
Tell me about your dog.
My dog is 95% idiot, 5% stuffer.
I'm coming, Pet, I'm coming.
How are you?
No, not too bad, my love. Thank you very much.
Good.
Yourself?
Yes, I'm fine, thank you.
Good.
Even better at 5:30 when I'm done.
Well, yes, indeed.
So, you were only taking amlodipine 10 milligrams, but your blood pressure was still raised. Thank you. You've been bashing yourself.
In actual fact, yes.
What did you
Basically, I opened the car door and the corner of the top of the car door was smack right in it.
Oh, dear.
It was painful, I'll tell you straight, it was.
What about the reason that you stopped taking all these tablets were the night sweats? Are they staying away?
I think so.
Good. What's your plans today?
I've got to go to a garden centre to get some fish.
All right.
It's a blue koi.
Very nice.
Yeah, but no, not for me. It's
All right.
a replacement for my friend who's on holiday and unfortunately the sun got to him. Virtually boiled him, which is not nice.
Were you looking after him now?
I nearly cried when I saw him. I'm supposed to be looking after him as well. It doesn't help, does it?
So you're going to complain and tell him the truth, the whole truth, and nothing but the truth?
Well, I didn't do it. It's the sun that boiled him, not me.
You're not just going to pretend that they're all OK?
Well, no, he was rather really fond of these fish, and I'm trying to get him some replacements before he comes home, because he'll go absolutely mind-boggling crackers if he finds them missing. And it isn't my fault, obviously.
No. OK, your blood pressure, average, is perfect.
Oh.
So we need to just leave your meds as they are now. You all right with that?
Indeedy, yes.
I hope you find the fish.
OK, my dear, thanks ever so much.
You're welcome. Let me get this door for you.
Yeah, indeed. I'll see you later, Pet.
See you later. Bye.
See you now. Bye-bye.
OK, let's have a look.
It's there. Yeah.
Do you want to just lie down? Let's have a feel. OK. Can you just lift your top
Yeah.
for me? OK. Just relax, OK?
It's just there.
Tender one.
Yeah.
Is that quite tender, isn't it?
Yeah.
It's a bit difficult to sort of say what is causing it, especially with your background history of sort of you're nearly the same time that you went into labour with your daughter, and obviously your tummy is soft at the moment. Yeah. You are tender, but you're tender in the lower part, like where the uterus is. Now, obviously that can be due to various reasons. I think the best option would be for you to be checked out in the maternity assessment unit. They can put the machine on and have a listen to the baby's heartbeat as well. How does that sound to you now?
Yeah, that's fine, yeah.
Let me see if I can ring them up. Hi, my name is Dr. Huck. I've got a lady who's 17 weeks pregnant. Basically, she's got a history of having a premature labour at about 18 weeks with the first child. So 2-day history of lower abdominal pain, which has just worsened overnight, and it feels like she describes them like strong contractions, and she's having some pain in her back passage, like a pressure. I just felt that if you could have a look at her. She went into labour at about 18 weeks?
Yeah, I'm 18 weeks tomorrow. Yeah. I had to have steroid drips with...
Sorry, she went into premature labour at 18 weeks and then she was having steroid injections. When was the baby born?
I delivered her at 37 weeks then.
She delivered at 37 weeks?
Yeah.
Yeah, OK then. Thank you so much. Thanks, bye. Yeah, they'll see you on the maternity. They said that once you've had the scan, you can go straight to her.
That's fine.
Anything in between changes, like, pain gets any worse, then you'll have to go straight away to the hospital.
No, that's
Take
fine.
your book with you.
No, but that's fine. Thank you so much.
You're
Thank
welcome.
you.
You're welcome. Take care. Hope everything goes okay for you.
Thank you.
Let me just show you that I wasn't kidding you.
Yeah, well, I'll have to go back and look, but I don't recall getting a WhatsApp from you.
Sorry it's late. We have a venue. What shall we have as a theme? Lol.
I don't recall getting that at all.
Well, I think that 2 ticks means you've read it, doesn't it?
Does.
It means
probably
you
am.
might be avoiding me.
Oh, no. No, 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 no.
New glasses on.
Oh, did
Hello,
you know?
Dr.
How are you?
I'm all right.
Oh, I'm so sorry about your dad.
Oh, me mum. And me mum.
What do you mean?
No, my mum's all right.
Oh, God, don't say that.
I mean, my mum's all right, but what we've heard about her.
Yeah, come
But
and sit
I know,
down.
but my poor dad. We've had a right time, haven't we, Dr. Khan?
Tell me what happened to your dad.
Well, he had pneumonia. Goes to the hospital a couple of weeks later, and his heart, the valves in his heart, they were just...
Oh, no.
And it was just a matter of days. And he went. That was it. But you know what? He went peacefully.
Did he?
Yeah.
Okay.
Yeah, he did. He went peacefully. And you know what? My mum hasn't been the same since.
No.
Oh, bless her.
How long have they been married for? Because they were so close, weren't they?
About 40 years.
Oh.
No.
And your mum's poorly.
And I wasn't going to cry.
Oh, it's okay to cry. Honestly, it's okay to cry. That's normal.
Oh, I don't know.
Well, why don't I come and see her at home?
You can come and see her anytime. But you know what? She's always asking about you.
Oh.
She is. I've got a Marks and Spencer's cream cake in the freezer waiting for him.
Has to be Marks and Spencer.
You know me so well.
It's
Marks and
waiting
Spencer,
for
cake. It's my favourite word. Right, we're doing your knee.
No.
No?
You're doing that and...
Yeah. Tell me about it.
It's that look at it, Dr. Khan.
So where are you getting the pain there, Diane?
All right.
Yeah.
Yeah.
And there.
And there.
So what we'll do, we'll go into this area here, and that will
Okay.
make its way along those there and there. So
Okay.
you know the drill. Can I get an orange knee?
Yeah.
please, Kat? Right, Diane, if you just come and rest your hand on here for us.
I will, Dr. Khan.
You know, Diane, you can call me Amir.
Amir.
Yeah.
I will do. I will do.
Great.
Dr. Khan sounds so
I know
formal,
it does,
doesn't
doesn't
it?
I think we're
will.
way past that.
It
aren't we?
won't let me
are.
call him Amir.
No.
I have to call him Professor.
Professor.
Yeah.
So here we go, just a sharp scratch. I know it's not very nice.
Well done. You okay?
Yeah, I'm fine, thank you.
I've not put it all in because I was getting ready for a knee, so I've only
Oh,
put
was you?
yeah, it's a small joint. There you go.
Smashing. Dr. Khan, you take care.
You
Lovely
take care.
seeing you.
Really nice to see
Oh,
you.
you too. Oh, do you know what? And I'll see you again. Come on.
will.
No, Liz, I'll give you one.
see you.
She looks nice in her glasses, doesn't she?
does. Yeah, she always looks nice.
Oh.
Yeah, yeah, you look nice. Oh, see you soon,
See ya.
Dr. Khan. Bye.
Dan, just press that green button on the left and the door.
This
will
one?
open. Yeah, that's it. And then just press.
Bye.
Cheers.
See you later.
I know. Okay.
Right, thank you.
All right. All the best.
Thanks a lot.
Okay. Cheers.
Thank you.
Thank you. See you later.
See you.
Okay then. Thank you for seeing me.
All right then. All right. Look after yourself.
Okay, thank you very much.
Take care, my love.
Thank you.
Bye-bye.
Bye.